Okay, some ideas about menopause and sleep. So what is it about menopause that is troubling you?
Hot flashes.
Hot flashes? What else?
Mood swings.
Mood swings?
No libido.
No libido? Anything else? Grumpy husbands? So that's a female's fate, unfortunately. And so what can we do to maybe improve it? I'm also a geriatrician, and I know in life I'm not going to fix everything, but if we can make things better, that's my goal when a geriatric patient shows up. I just really try hard to make life better in some way. Okay, let's get back to where we were.
Are you doing the sleep studies here at the homes?
Yes, ma'am. I read them all. I like reading sleep studies. For me, it's almost not even a job. It's so much fun that my wife has taken the computer away from me at night because I was not coming to bed till like 4 in the morning. It's just, there are all these squiggly lines, and it's like a puzzle, and everything's different, and the brains are different, and you find these really neat things. So it's a little too much fun. It's almost out there. But yes, I read them all. Very good. And then everybody's got about 800 pages of life to look at. That's what a sleep study comes out at, 800,000 pages. And children's studies are really unique. The little brains, they don't follow the rules. We have these rules, and all of you who have raised kids, kids just don't follow the rules. But their brains don't follow the rules. And the adult sleep specialists who don't do children, they say, you can't do that. I said, but he hasn't read the book yet. It's a kid only 3 months old. Read the book. Then their brains will work. So, okay, so a normal sleep pattern. In a typical child, you have a sleep pattern that goes down to stage 3 sleep there, rapid eye movement sleep there, more stage 3, and that's a young person's brain. But then, a typical adult will fall asleep, go into stage 2 sleep, and I think I put labels on this, I did. And you notice that what's missing in the adult brain? A lot less stage 3. And we used to think all adults were that way, but in 1997 we did the heart health study where they took 6,600 people and they followed them all these years, and we're finding out that this down here is more common in men, and women have more stage 3 sleep than men.
What is stage 3? And I'm sorry, I need the
Oh,
primer.
No, please ask me. Please ask me. Don't let me get away with that. When you fall asleep, you have 3 stages of sleep. Actually, we consider sleep 5 stages. Wake, or non-sleep. Stage 1 sleep, you're just barely drifting off. That's the sleep where sometimes you're so sleepy you have a jerk, you feel like you're falling, you feel like that's in stage 1. Okay? And then stage 2 sleep, you've got these huge spindles in the brain. I see spindles. They look like little squiggly lines. And what that is there's a organ structure in the brain called the thalamus, and it releases these little spindles, and they go to the surface of the brain, and you have spindles there. And the way to think about it, if you were running in your house and you throw yourself on the floor, what would that feel like? It hurt. But if you run through your house and you got a bed full of springs and you throw yourself on the bed with springs, not too bad. And so the brain does this. It goes into this springy stage where it just cushions the outside world. Stay away. I want to stay inside, sleep. So that's stage 2 sleep. And then in the first part of the night, you got these huge waves that come out. And that's stage 3 sleep. So different kind of waves in different kind of stages. Stage 1 has mini waves. Stage 2 has spindles and these things called Ks. But I always think of spindles like little cushions. And stage 3 is these big, massive waves. And it's a very deep sleep.
So do different things happen that are restorative in those different stages?
Yes.
Okay.
And then the black is rapid eye movement sleep where your eyes are just moving all over the place. And a gentleman named Adnersky discovered it by accident. He had his 8-year-old child sitting in the other room, he's a neurologist. He said, I need a victim to practice on. So he puts these wires on his 8-year-old, and next thing you know, his eyes are moving all over, and he says, I wonder what he's doing. And he walks in, and the kid's fast asleep. And he discovers when you're dreaming, your eyes are rapidly moving everywhere. So it was an accident, and then we developed sleep medicine from there. We realized there's a whole world within a world when you sleep, which is why when you don't sleep, going through menopause, you don't feel as well. Because you're eliminating stages of sleep. You want to do everything you can to maintain good sleep, because then other things begin to happen.
Where do hot flashes happen most?
Or it can happen all night long, as you know.
So there's not a certain thing in your brain that triggers the hot flash?
No.
A stage. There's no
Age.
sleep stage there, prevalent.
I haven't seen a prevalence in one stage over the other. But I think what happens is your hormones are regulated best if you go through all the sleep cycles you're supposed to. Because if you don't go through all the sleep cycles, then something's missing. So we know hormones are greatly affected by sleep. The last group, for men and probably for women that you have just little blips of testosterone. You need a little testosterone. Men have more of it, women have far less. You know, lower estrogen, women have far less. But if you don't sleep while you're tossing and turning and you're not going through these stages, you may not go into rapid eye movement sleep. Or you may have just little pieces of it. But what happens when you first rapid eye movement sleep is you get a little blip of testosterone. And so some men, they come and go, I need testosterone or whatever, rub on their chest or something. And what happens is, if you don't get this blip of testosterone because your sleep's so broken, for men anyway, let's say they need 50 milligrams of testosterone. Well, the first 25 come here, and then when they wake up, they get the next 25. But if they don't get the first 25, their testosterone levels are too low. And so it's the same thing. There are hormones being released during these different stages. During stage 3, you get growth hormone. But if you don't go into stage 3, you don't have growth hormone. And so these different stages of sleep are what's driving some of your hormones. So how is it that I can get into these stages of sleep? What is the best way to get into these stages of sleep? And I know there's a lot of things that we use. The hormone replacement therapy, part of why it works for nighttime sleep is progesterone is a respiratory stimulant. It helps to stimulate respiration when you're sleeping. And so we see that in women after menopause, because progesterone and estrogen drop, the level of sleep apnea doubles. Because now you don't have this something driving your respiratory function when you're sleeping. And so the key is to find a way to sleep as well as you can. And this heart health study of 1997 96 or 97, I'll have to look that up. It shows that women actually sleep better than men as we get older. But mentally, it affects you worse, probably because of these other factors. So that's what we need to have happen, is get good sleep. So what medications have you seen out there for hormone replacement? Or to help with menopause? Doctor's not throwing any at you?
Ashwagandha, melatonin,
I mean,
yeah, hormone, you're talking about just,
or, yeah.
Things we can do
Unwired.
better.
yeah.
Okay, so
That's
how do we naturally improve our sleep? One way to naturally improve your sleep is melatonin. But you have to get a pure melatonin. If you look at some of the bottles, they'll have B6 and I don't know, other stuff in it, and that's not good, particularly B6. And I learned that from one of my 73-year-old patients who listened to me, took melatonin, it was wide awake till 3 in the morning, and she looked at the bottle and there's B6, and so she scolded the pharmacist endlessly because he didn't know either. So it has to be pure melatonin. There's a product called Pure Encapsulations that is probably among the purest that I'm aware of. In Europe, and I'm going to do this next time in Europe, sleep specialists tell me that the melatonin in Europe, because it's prescription grade, is far better than anything we have in the US, because we don't have prescriptions for melatonin here. And so the Europeans, they make this melatonin, and other sleep specialists say it's like taking a sleeping pill. Down you go. So next time in Europe, I'm gonna fill my suitcase with that stuff. But Pure Encapsulations prides themselves in making the same ingredient every single batch. The Medical Letter published an article 2 summers ago that said within companies that make melatonin, there can be a 300% difference in batch to batch. So the melatonin you're taking today may have nothing, may have horse grass, I don't know, pizza, or it may have 10 milligrams and it says 1. So trying to find a company that prides themselves and say, the pharmacists have assured me that this company does it. Every batch is the same, 1 milligram every batch. Okay, so that's one thing. Now the reason you take melatonin is because at age 1, let's just say you have 100 grams of melatonin being released. At age 70, you might have 5. So all your life, melatonin is decreasing in a linear fashion. And the reason you sleep is melatonin goes up and your body temperature goes down. This is why after a nice hot shower and you jump into bed and some people just go right to sleep. It's because the temperature's going down and melatonin's going up. But as we get older, particularly even in menopause, we are in that halfway cycle that, our brain loved it when you got 100 milligrams. Now you're getting 50, 40, 30. And so melatonin is can be a real positive thing for some women. Take it regularly. 1/2 to 1 milligram is really about all you need.
Is there a better time to take it?
About an hour before you go to bed.
Okay.
Yeah, about an hour before you go to bed.
And what about tryptophan?
Tryptophan is okay. Tryptophan's okay. Or eat a big piece of turkey. But yeah, that's okay. Tryptophan is converted, I believe, with norepi into melatonin. So that's okay. I don't think you should take both, but I like to take less. So melatonin is a good choice. All right. How about medications? Out of all the medications, and we've all, as doctors, we've gone through the cycle, this is good, this is good. And so anymore, just whatever will work for you is the right way. For a while, venlafaxine was being pushed as a reducing symptoms. Venlafaxine is an antidepressant that gives you epi and norepi increases in the brain. And so they're reporting a 50% reduction in symptoms. Effexor is the other name for venlafaxine. And I don't know that it really on my patients that did that well. But if you have to take a drug and you have really good kidneys, you might consider gabapentin. Why gabapentin? Because gabapentin does two things, particularly in women. It increases stage 3 sleep and it increases REM sleep. So from a sleep perspective, my goal is to try to restore sleep, because I know if I can restore sleep, then I can lower symptoms, because whatever the hormonal units are that are working all night, they're going to be maximized. Okay? So my two favorite medications are gabapentin and melatonin. But that's why. Does that kind of make sense? So, let me get rid of that one. So in a normal sleep pattern, the other reason is to sleep more normally is because if you have a delayed sleep pattern, you're tossing and turning, and you don't fall asleep till 2 in the morning when you normally would fall asleep at 10 or 11, that has a propensity to make you gain weight. And some women tell me that they have a heck of a time since menopause with their weight. It's just showed up one day, you know. And they're doing everything possible. And the reason that you gain weight is because there's a circadian cycle, a genetic cycle that you grow up with. And we used to think it was eat dinner, and that kind of promoted the evening. But sometimes the evening works backwards, so that if you're falling asleep at 2, what is it that you normally do before 2? Well, melatonin about an hour, and so it begins to be released at 1 o'clock instead of 9 o'clock. So that's already disrupting your sleep cycle and the way your brain likes to work. But then what happens when you work backwards? We have an extra meal or a snack, or out comes the ice cream half gallon. Next thing you know, it disappeared. So there's this hunger that begins to kick in because you already had the 6 p.m. meal. And the other thing that happens when you don't have good sleep is there are 2 hormones in your body that you have to deal with. All of us have to deal with. It's called leptin and ghrelin. Ghrelin growls. It's from the stomach. And when you don't sleep enough, you have higher levels of ghrelin. So you're just going to want to eat more. And leptin, L-E-P-T-I-N, is secreted from the fat cells. And when you sleep sufficiently, you have nice levels of leptin, and they tell your brain you're full, you can stop eating, take it easy. Leptin also drives respiratory function when you're sleeping. So these 2 hormones work in balance with each other. And so when people are sleep deprived and you're not sleeping well and you don't have the nice stages of sleep, there's a much higher propensity to just eat more. And then when you eat more, and you combine that with hot flashes and tossing and turning at night, it just becomes a vicious cycle, and then you feel even worse. So leptin says you're full, you've had enough. Ghrelin says eat more. Okay, questions? Supposed to quit at 12:30. So yes, ma'am.
How does Benadryl affect sleep?
How does Benadryl affect sleep?
Yeah, I mean, does it let you go through the normal sleep patterns, or?
Benadryl's actually pretty good.
Okay.
I mean, it's not terrible, it's actually pretty good. Benadryl binds an area of the brain that releases histamine, right?
Mm-hmm.
And histamine wakes you up. So Benadryl goes to that part of the brain and just says, stay asleep, and then, but sleep-wise, it's not too bad. But I would only take low doses.
Mm-hmm.
And if you feel better, that's even better. The problem is as we get older, particularly once you break the 65, 70 mark, Benadryl can cause urinary retention and confusion. So you have to kind of, if you have a spouse when I give medications, I always ask the individual, ask your spouse or your partner how it's affecting you. Because sometimes the partner will see how it affects you and you can't see it. I just started someone on Abilify, tiny dose, 1 milligram. And he just sent me a note, I don't see any difference, so I sent him back, ask your wife. And I just got a note on the way over here, massive difference. See, so sometimes we can't see it, but all these drugs that put you to sleep and stuff, ask your spouse or your partner if you have one. What about taking Ambien? Some of us take Ambien, right? If you take Ambien, it's not that drug, but maybe take half a dose of melatonin. What Ambien can do is, Ambien's really good, a good sleeping agent. But if you've had a history of sleepwalking, sleep talking, right, Ambien can precipitate those things. But if you cut the dose in half, oftentimes you can sleep to the night. So that's not a bad one. But melatonin is still my favorite. Other questions?
I have a question.
Yes, ma'am.
So if you had a patient come to you with history of breast cancer that's non-receptive, would you recommend those drugs?
Melatonin and gabapentin, yes. I'm not aware of any contraindication of those two. The only contraindication of gabapentin is if you have renal failure, kidney failure. Because if you have kidney failure, it's excreted through the kidneys and then you might build up. But it's still, then you just have to recalculate the dose. But it's a pretty safe drug, and I try to find medications where nothing happens. Meaning I don't hear any mischief going on. If you take something like gabapentin and you feel a little sedate the next day, then you just take a lower dose. But gabapentin doesn't usually hang around that long. Usually by 8 hours it's out of your system. At doses start at 100 milligrams, you can go all the way to 1,200 milligrams. Most people do pretty good at 300, 600. And so it promotes stage 3 sleep, promotes REM. It makes you a little just sleepy when you take it, which is good, because you're going to sleep anyway.
And improves hot flashes.
And it improves hot flashes.
Yeah, I treated 900 milligrams, 390.
You're treated with that? Oh.
I'm a physician, so, and it was, yeah, gabapentin or Neurontin.
I imagine Lyrica will work too, but it's an expensive melatonin. So one more thing about gabapentin.
Sometimes it can gain.
Oh, restless legs. Yes, if you have restless legs or legs that have to move all night, it's really good. It's my #1 agent for restless legs. The FDA says push a drug called pramipexole as first line, and they work. But those particular drugs, because they increase dopamine, they can make people a little compulsive. So 17% of people will develop some compulsion. I have a woman, she didn't realize her doctor gave her pramipexole. The trade name is Requip, and once she started it, what she does at night, every night she checks her windows and doors at least 10 to 15 times. And she didn't realize what was causing this. She just said, I don't know why I'm doing that. Checking my doors 10, 15 times now. And it's the pramipexole. So it can have compulsive behavior. That's why it's not my first line agent. But gabapentin, because of these other things, is usually what I pick first. Okay, any other questions?
I have a
Yes,
question.
ma'am.
What happens to me is that I am able to fall asleep, let's say at 11 o'clock, and then within 20 minutes, I wake up and I'm awake for like 2-3 hours.
Have you tried gabapentin?
I have not. I have not tried any.
I've tried that.
Okay.
I've tried that. And if you do end up, because sometimes you just end up on a drug like Ambien, the long-acting form is probably the best. Lunesta is not the best.
Okay.
Lunesta, it has a 6-hour half-life, but the problem with Lunesta is When they made it as the new benzodiazepine. Because, I didn't put you in a coma or anything, but if you look at all the receptors that benzos hit, Lunesta hits 4 of the 5 receptors, whereas Ambien and the other ones hit 2 receptors. And so you want the cleanest drug that gives you the effect you want. So I haven't prescribed Lunesta. I don't know if I've ever prescribed. But Ambien, a good choice. Sometimes you just have to end up there if nothing else is working. But I would try the gabapentin and the melatonin. That's more of a natural because of pushing this stuff, okay? Other questions? I got all this information that puts you in a coma, so I don't want to put you in a coma either.
Not during the day.
What's that?
We want to sleep at night, not during the day.
Correct. Right. Yeah, we don't want to put you in a coma. But the other thing that will happen is just because if you don't get enough sleep and you start waking up at the odd times, you begin to have other things happen. And you'll see people when they wake up and are sleeping, instead of 8 hours, they sleep 6 hours, they wake up in REM sleep. They'll wake up with their eyes open and they're paralyzed, and it scares them. And it's because they haven't had enough sleep. They're in menopause, they're not sleeping 5 hours, and you wake up and they don't know what to do. They're just paralyzed. This is the Sleeping Beauty syndrome. How do we wake up Sleeping Beauty? A kiss, yes. And there's some people that have this happen so often that I just say, just have your partner, if they like you, kiss you in the morning. And that just breaks the cycle. But they're waking up in REM sleep. Because in rapid eye movement sleep, the body's paralyzed. Otherwise you'd act out your dreams. And melatonin actually, for people that have partners that are acting out their dreams, it helps to suppress that greatly. Because it's a natural product. Well, I'll hang out if you have more questions, but thank you so much for being willing to listen.
Thank you.
But anyway, I can introduce myself. Did I? Did I introduce myself?
No.
Oh, I'm sorry. I'm Dr. Ralls. I work for Quality Sleep Solutions. I apologize. I didn't.
We're located on the 3rd floor.
We're on the 3rd floor.
Yes, that's where we do our sleep studies. So if
So-
you ever are available, we would love to have you take a tour and to go to our rooms. Welcome.
All right. Well, I wish you could let me know how it goes with the gabapentin. I always like to hear the end of the story. But, all right. Take care. Thank you.
Thank you.